Hello everyone, welcome back. For those of you who are new here, my name is Magdalena Bujalski and this is my cancer journey. So today we're filming this video looking like a 12-year-old boy. I figured I would show some hair growth progress while I was at it. A little hair update. So this is growth. It's been about, I guess, 6-7 weeks after chemo now. And this is what my hair looks like. But next week I am going to get a buzz cut done just because I've heard that if you shave it down, it may grow back a little bit thicker or stronger. I've noticed that my hairs are kind of in Polish you say piórka, very thin, feathery hair, like fluffs, like chicken fluffs almost. And that's what my hair's like right now. You can't really tell, but if you go really close, that's what it is. So I'm gonna shave it down. Hopefully it'll grow back thicker and I won't have piórka hair. Also, another quick thing to mention beforehand, September is Blood Cancer Awareness Month, and we know that I'm all about awareness, so I will be doing some special videos specifically for blood cancer awareness. Stay tuned until the end of this video where you can find out how to submit your questions. Alright, so I really wanted to make a video about how to prepare for chemotherapy, not only just right before your treatment, like the day before, but also prior to commencing chemo period. I think there's a few things that can be done that can help in the future, help in the long run, that you don't necessarily know about. There are certainly a few things that I wish I had known about before I began chemo, which is why I want to share them with you today. The first point's a little bit of a tough one, also kind of really depends on your age and where you are in your life, but that would be freezing your eggs or your sperm, or kind of just making plans for that in the future. I feel like I wasn't informed enough about this before I began my chemo. I also didn't really have the chance to do this. Shortly after I was diagnosed, I began chemotherapy treatment. My tumor was just very aggressive and it was spreading, and unfortunately once I started chemo it was already too late to freeze my eggs. But if you are beginning chemotherapy treatment and you do have some time and that is kind of something that's very important to you, I certainly recommend looking into it and at least being informed about it and knowing what your options are. The second thing to do before you begin chemo initially is to tell everyone that you need to tell about your diagnosis and your treatment plan. I know that it can be really hard to share stuff like that about yourself to people, and it's really tough, especially if you're saying it in person. But trust me, it's much easier to get it over with before you start your treatment because you're not going to be feeling great. And I think giving the news and then having people want to come see you and visit you, because that's what happens when you get sick. People want to see you, people want to visit you. And having people do that when you're going through chemo is not necessarily just the easiest thing to do. So my advice to you is just tell everyone that you need to tell, and then bouncing off of that, make plans for work and school. When I first got diagnosed, I was like, nope, I'm gonna work right through chemo. I'm not gonna let it stop me. This doesn't matter. I'm gonna finish school. I'm gonna keep working full time. I'm just gonna tough it out. Yeah, that's not how it went for me. I did luckily finish school, which was amazing. I did try working, but that only really worked out for me until my second cycle of chemo. I just realized that I really didn't feel good, and my career just meant a lot to me, so I figured that for me and for my employer, it was just best that I leave it aside for now so I can give my all when I'm better. And some people are able to work through chemo, no problems. It hits everyone differently, right? So if you're trying to work through chemo, just make plans for just in case, whether that be to take time off or to have a lighter workload or to be able to work from home if that's a possibility. And then school-wise as well, whether that be to take a lighter school load, to take a semester or two off completely to focus on treatment, or just even letting your profs and teachers know that this is what you are going through and that you may need some extra help along the way. Third thing is to buy wigs and head covers before you start chemo. Again, after treatment, you don't know how you're gonna feel. It's kind of like a gamble. So get all the tough stuff out of the way. Your hair's not gonna start falling out for a little while after chemo, but sometimes they don't have the wigs right away. You have to order them. For me, I had to wait 2 to 3 weeks to get my wigs. And it's also a tiring process, trying on different wigs, trying on different styles, sometimes going to different places, or buy your wig online, because if you do buy your wig online, it's also gonna take a few days or weeks to come in. And that same thing goes for head covers and stuff. You want to be comfortable right away when your hair goes, so make sure you just have some ready for you when that does happen. And my last tip of advice before you start your chemo initially is to go to the dentist. So this is something that I didn't know, but when you're going through chemo, your body is so weak and you are so susceptible to infection that it is very, very strongly advised to avoid going to the dentist or getting any procedures. So go to the dentist if you are able to beforehand, just to get everything checked out, get any cleanings and fillings that you may need, so that way when you're doing your chemo for X amount of months, you're kind of in the clear and you know that you're doing good, instead of having a painful cavity that you can't really get fixed until you're all clear by your oncologist. Okay, also, before I get there, notice like the matchiness of like the cup with the outfit, with the home decor, with the eyes. Like, this is so pleasing me right now. Okay, now we're getting to the video. Alrighty, and now for my tips on what to do right before your treatment. Yeah, I didn't know what to expect when I was going into chemo. I kind of like did a whole fly by the seat of my pants thing for the first 2 treatments at least. And then I think after the second treatment, I kind of knew what to expect. So I kind of developed like this little schedule for myself almost. So my first tip is to arrange rides and help for after your chemos. It's so possible that one round you feel good, one round you don't, so it's different every time. So just make sure you have that one person that, or a few people that are going to help you out when you need to initially right after each treatment. My next tip is something that I was really bad at. Get your medications from the pharmacy before your treatment. In most cases, you are gonna have to take some medications at home, and those are usually refillable. Mine were refillable, so I would get a certain amount of pills for after each cycle, and then I'd have to get more pills before the next cycle. I was really bad at getting that done on time. I think there was at least 3 times where I would call the pharmacy an hour before they closed or the night before, being like, OMG, I am so sorry, I forgot to call, can you please have these ready for me? Luckily, my pharmacist is a good guy and would get it done for me on time and didn't give me trouble for being so late, but just make sure you have your medication, because if it does happen that you forget them, sometimes you may have to stall your chemo, sometimes you may not have the proper medication that you need, and that's just gonna mess things up for you. Put a reminder on your phone, which is what I should have done, to get all your medications on time. This one is for all my adulting friends out there. Stock up on food, get your groceries out of the way and your chemo food before your treatment. So that was also kind of part of my routine before chemo. I'd always go grocery shopping the day or 2 days beforehand, and then just be conscious of the kinds of foods that you can and cannot eat after chemo. So for me, I couldn't eat anything with a smell or a weird texture that really just made me super duper nauseous. So before each chemo, when I'd go grocery shopping, I would buy lots of crackers, lots of bread, lots of things that were easy for me, tortilla chips, and lots of water. You need lots and lots of water to help flush everything out. I also made like detox smoothies and stuff like that, so I made sure I had all the ingredients for that. And then just food in general, so that way Alex and I had stuff to eat throughout the next week when I would completely be out of commission. But then to bounce off of that, meal prep as well. So if you're somebody who knows that like you'll be able to eat specific meals, make those meals ahead of time so you have them ready to go, because that just makes it so much easier when you're hungry and you're way too weak to make any kind of food. You'll just be able to quickly heat up or fix up those meals for yourself, and it'll help you out so much more. And another adulting tip is to clean your house and get the laundry done before chemo. I know this sounds ridiculous, but a messy house really irks my nerve, and just when you're feeling sick and you're just laying there staring at the walls, if that house is messy, it is gonna drive you crazy. So I like to just have a nice, clean, fresh house to come home to when I feel really sick. And laundry obviously done. You don't want to stare at a pile of laundry and think, oh my God, I need to get that done. So just get all of those adulting tasks out of the way before your chemo. You're gonna feel so much better, just even mentally, when you don't have to think about it. This next tip is a tip that I got from a friend of mine who also went through similar chemotherapy treatment about a year before me, and she told me to always have clean bed sheets for when you come home from chemo. I didn't realize how much I appreciated that, but just having fresh, clean, nice smelling bed sheets is just so comforting, especially when you have to spend some quality time in your bed because you feel like garbage. So my go-to was always the night before, I put some clean bed sheets on, and that way you just get into a nice cozy bed after chemo. And my last and final tip is a very, very important one. Lots and lots of water. So if you've watched my previous video on what to bring to chemo, you'll know that I became a human pincushion sometimes at chemo, and that was partially due to the fact that I didn't drink lots of fluids before chemo, and then I kind of realized that I had to. So the day before and the morning of, I would always force myself to drink lots and lots of water. This helps your veins get nice, big, and juicy, so that way the nurse is able to easily locate a vein and the veins don't try to hide. This obviously only applies if you have IV infusions like I did. If you have a PICC line or a port, you don't really need to worry about that. However, if you're getting blood work done, that is something that you need to worry about if they're giving you an IV. If you're getting your PICC line inserted for the first time, or your port inserted for the first time as well, that's also surgery, you probably need to have good veins as well. Regardless of how you get your chemo, just drink lots and lots and lots of water. Alrighty, and that wraps up my video on things you need to do before your chemotherapy treatment. Like I said in the beginning of the video, September is Blood Cancer Awareness Month, and I did want to do a few videos to raise awareness for blood cancer. So if you do have any questions that you want me to answer about blood cancer in general, my journey, or just cancer, please leave them in the comments down below. But for now, that is all. So know yourself, know your body, and until next time.